Welcome back to The Explainer. Today, we're going to talk about something truly profound, the meticulous, compassionate, and incredible process behind brain-dead organ donation.
You know, this entire journey, it all begins with one single, incredibly generous choice. It's a decision, usually made in a moment of immense tragedy to create purpose and to give hope to others.
And the impact of that decision, well, it's just staggering. I mean, get this, a single organ donor can save up to 8 lives. 8! That's 8 people who get a second chance, all because of one person's generosity. It's a truly incredible ripple effect.
So, how do medical professionals navigate this incredibly sensitive journey? Let's dive in. It all starts with a diagnosis that has to be absolutely 100% clear and irreversible: brainstem death. So what exactly is brain death? It's a term we hear a lot, but honestly, it can be pretty confusing. It is not a coma. It's not a persistent vegetative state. It's something else entirely, a state of absolute medical finality.
Okay, so here's the crucial definition. Brainstem death is the complete and permanent end of all functions of the brainstem. Now that's the part of the brain that controls our most basic functions, right? Like consciousness and our drive to breathe. That word irreversible is key. It means there is zero, and I mean zero chance of recovery.
To confirm this diagnosis, there is a legal and medically airtight process that has to be followed. There is absolutely no room for error because every single step is designed to achieve absolute certainty.
So the very first step is caution. Before doctors can even begin to consider a diagnosis of brain death, they have to play detective. They have to rule out every other possibility. Could this be a drug overdose, or maybe severe hypothermia? They meticulously check for any condition that could mimic brain death but is actually reversible.
After that, they move on to the physical examination. The medical team tests for the most basic involuntary reflexes that are controlled by the brainstem. Do the pupils react to light? Is there a gag reflex? These are things our bodies just do automatically. For a diagnosis of brain death, every single one of these reflexes has to be completely absent. But the most definitive confirmation is something called the apnea test. See, our body's ultimate survival reflex is to breathe when carbon dioxide builds up. In this very carefully controlled test, doctors see if the brainstem will trigger that reflex. If there's no attempt to breathe, it's the final, conclusive proof that the brainstem has permanently stopped working. And this isn't just a one-and-done deal. To ensure absolute, unquestionable certainty, the entire set of tests, including that critical apnea test, has to be performed twice. For adults, these 2 full examinations are separated by at least 6 hours. And of course, everything is meticulously documented. Every observation, every test result, every signature is recorded on a legal document like this Form 10. This isn't just paperwork, it's the final, transparent, and legally binding certification of death. Now, this next point can be really tough for families to see and understand. Even after brain death, the body can sometimes move on its own. A hand might twitch or an arm might flex. These are just simple spinal reflexes, where the spinal cord acts independently, completely without input from the brain. Doctors are experts at telling these apart from any purposeful movements that would signal brain function. Okay, so once brain death is legally declared and consent is given, the medical team's focus shifts completely. Their new mission is to care for the donor's body, to preserve that precious gift of their organs for the recipients who are waiting. The body is now in a very fragile state, and the ICU team works tirelessly to protect the organs. They often follow what's called the Rule of 100, trying to hit key targets like a stable blood pressure over 100. Every number on this chart represents a vital parameter they have to maintain to keep the organs healthy. Think about it. Without the brainstem acting as the body's control center, the hormonal systems just go haywire. So the medical team has to step in, almost becoming the body's external regulator. They use specific hormone therapies, like the ones you see here, that manage everything from blood pressure to sodium levels, creating an artificial stability to preserve those organs. At the exact same time, a whole bunch of tests are being run. We're talking blood work, ultrasounds, detailed cardiac echoes. Every organ is thoroughly checked to make sure it is healthy and suitable for transplant. It's all about matching the perfect gift to the person who needs it. With the family's consent secured and the donor's body stabilized, the final act of this incredible journey begins. It becomes a carefully coordinated, high-stakes race to get the organs to the people who need them most. And this is where the clock starts ticking fast.
Every organ has a kind of expiration date. A heart or lungs, they only have about 4 to 6 hours to get from the donor to the recipient. The logistics have to be absolutely flawless. There's just no time to spare.
To make this happen, something amazing called a green corridor is often created. This is where police and traffic authorities literally clear a route for the ambulance. It's a powerful symbol of an entire community coming together to make sure the gift of life arrives without losing a single second.
So, after seeing this incredible, complex, and deeply human process, you're probably asking yourself, what can I do? How can I be a part of this story?
You know, the most important thing you can do is really simple. Just have the conversation. Talk to your family and make your wishes known. By choosing to be a donor, you're making a decision that reaches far beyond your own lifetime. It's a choice to ensure that your final act isn't an ending, but a new beginning for someone else.